Well, hello and welcome to all of you around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications, and one of the MCs here at Gold Learning. Well, I am delighted to be talking and sharing about our upcoming Gold Neonatal Conference. We're now so excited into our 5th year, and my first guest that I get to interview today is Mohan Pammi, who's going to be here with us as part of our conference. And I'm absolutely delighted he's going to be here because we're going to be talking about some of the things that he studies as part of his work as well. But Mohan, welcome to Gold Neonatal. I'm absolutely excited to have you here. You're going to be talking about COVID-19 in the neonatal intensive care unit. But first of all, could you please just introduce yourself and tell us a little bit about where you are in the world and what you do there?
Thank you, Fiona. Thank you for the kind introduction. Good morning, everyone. I am in Houston, Texas. I'm a neonatologist working at Texas Children's Hospital in Houston, Texas. I've been a medical director for my unit, but I recently stepped down, and my interest is in researching the perinatal microbiome, especially in preterm infants. I know we heard a lot of, it's a very hot topic, and a lot of people are doing a lot of microbiome research, and we feel that the preterm baby also deserves some research so that we can get into the problems these little preterm babies have, and then we can do something about it.
Yeah, absolutely. And so, of course, off camera, we were talking a little bit about this because I said, the microbiome has become one of my favorite topics. Working in the lactation field and understanding how it works and how it transfers between mother and baby and both parents as well. So it's definitely very exciting. But could you tell me a little bit about, the discoveries really of why this became so important in the neonatal unit and how it's sort of expanded in research over the last few years, Mohan?
Yeah. We still are trying to understand, what all those bugs on the human body are doing. That's
Right.
exactly the microbiome.
Mm-hmm.
There's a lot and lots of research in adults, in elderly people and children, if you will, looking at the microbiome and various human diseases, maybe obesity, inflammatory bowel disease, colon cancer, and so on.
Right.
But we also know that the preterm, just after birth, premature infants go through a rapid growth and development, not only in their body, but also on the growth of microbiome on their body.
Right.
The main place for a preterm microbiome is the gut. So we are trying to understand what's happening in this preterm baby because they're obviously very premature. They're not come at the right time.
Sure.
So obviously it's going to shift a little bit. Now, are these shifts in the microbiome as they develop in a preterm infant cause disease? Or are they associated with some kind of disease in the preterm baby like necrotizing enterocolitis, infections, etc.?
Yeah. Boy, this is so, I mean, this feels like it's endless, in terms of research and the potential that we could discover. Because it's, when we invest, I feel like this is a long-term project because we're talking about people's lives in the future. And I think it hasn't always been well recognized, in the sense that, why would you study something like this? Well, we know that it has that protective course. We've known about, NEC for a long time and how that impacts the gut, and it can be devastating. But it goes way beyond that now. And so tell me, how long have you been studying the microbiome right now, Mohan?
More than 10 years, I think. I've
Wow.
been very, very fortunate because in my hospital at the
Yes.
Texas Children's Hospital and the Baylor College of Medicine, there are big labs, who
Right.
have the resources to study this.
Ah,
So I collaborate with them. So maybe
yeah.
I'm in the right place at the right time. And so certainly, this has been a real pleasure studying this.
Yeah, that's fabulous. Do you get the opportunity to talk with researchers around the world and share some of the things that you're discovering? So, what's the international platform looking like when it's studying the microbiome right now?
Absolutely. That is a fantastic question, Fiona. It's the research is you don't just do it in your own lab and keep it to yourself. It always helps when you spread it around, learn from others, talk to others. Actually, as time, just last weekend, we had the Pediatric Academic Societies meeting, the
Oh,
first half of the Pediatric Academic Societies meeting, and I chaired a session on the microbiome and metabolites. It
uh-huh.
was a fantastic discussion. Yes,
Oh,
we go to
wow.
national conferences, talk with other researchers, and
Hmm.
certainly spread the word around.
Yeah, no, that's fantastic. And as I have come to understand, our numbers in preterm infants is on the rise. And so this is definitely an area that we need to be well versed in to utilize as best as we can and really understand what's happening through all the stages of growth for the neonate, correct?
Absolutely,
Yeah.
absolutely.
Yeah, no, it's just so fascinating. Well, let's talk a little bit about your topic. Now, of course,
Mhm.
as we're coming to you live today, we are still currently in the pandemic, and many folks around the world have had an opportunity to get vaccinated as we speak, and are, moving forward. Restrictions have been lessened, but there are many folks who are still in dire need and need support, which means that our neonatal units are still needing support. They're still dealing with very dire situations as well. And your topic that you're bringing to us as part of our Gold Neonatal Conference is talking about COVID-19 in the neonatal unit. So tell me, I want to, I'm so fascinated about A, what you're going to talk about, and B, how things have changed over the last, 15 months in your facility. So can you share a couple of little snippets about what's been happening for you in the units there?
Yeah, certainly, certainly, Fiona. When all this started, maybe last year, January, February, when things started worsening with the COVID, and we had lots of COVID, in the place where I work, we really had to jump in and make a lot of changes.
Hmm.
And these changes, like any of us, the parents are scared what
Mm,
will happen to their kids. We are scared, like we don't want to spread COVID in the unit, and we want
sure.
to contain it, take care of these babies and all that. So we have to change our workflow in many different ways. The
Hmm.
hospital as a whole is also changing its workflow. A simple thing would be previously we just walk into the hospital if somebody calls me, and then you can go to any unit. But once
Right.
COVID starts, you got to be screened, temperature, you got to sign in, you got
Hmm.
to come in. There are restrictions for parents. So a whole lot of things has changed.
Yeah. I think that with the whole screening process and I think the lot of I mean we've been dealing with a lot of unknowns. I think that's probably the biggest parameter that has shifted is that we sort of start a protocol, then we change it, or we have to enhance it again. Those types of things. So
Mm,
really being on our toes has been part of what has been happening, but a lot of unknowns as we've moved forward. I can imagine that some of the parents on the units have had a lot of stress because along with a preterm infant, a sick child, there are a lot of worries anyways, but this is just a whole new level of worry for those families. Have you been able to has the neonatal unit been able to provide more supports? Or I mean, we are all in this together, but what has happened in that element as well, Mohan?
yeah, it's a great question, Fiona. Uh, you know, uh, it's not good to have a preterm baby, period.
Hmm.
And it's not good to have a preterm baby in the times of COVID.
Right.
It's so very disrupting for the family.
Hmm.
Previously, the family can come in, visit the preterm babies, spend time with the preterm babies, but now there is huge restrictions.
Right.
Only one parent can come at any particular time.
Hmm.
And just imagine if that parent is under investigation for COVID or is COVID positive,
Oh yeah.
then they cannot
Right.
visit the unit.
Hmm.
Having a preterm baby, preterm labor, and now you're sick with COVID and you can't visit your baby, that's put a lot of stress on anybody.
Yeah.
So we try to understand the situation a little better. We try to include some smart devices where
Right.
we would give the babies, something like FaceTime, but a little more sophisticated than that on an
Sure.
iPad.
Yeah.
So we let the mother, see the baby through that
Oh.
particular device, talk with them, hear the baby, and we kind of after rounds, we used to talk with the parents in person, but now we pick up our phones,
Right.
talk with the parents, and sometimes we let parents join our rounds because now
Oh,
we do rounds with a
sure.
webcam. and also with some headphone sets. So
Ah.
parents can listen in while the rounds are being done and plans are being made for the preterm babies.
Wow. Wow. Well, I tell you that that seemed to hit a nerve a little bit with me. So I have to tell you that I was a parent in the NICU with one of my children, and so this took me right back. You know, I was able to be there many moons ago with my child on the unit, but I know that there were times when I couldn't be there, and that was a stressor for me. So I can't imagine, you know, how it has been for these parents to be completely removed at times, and not have access for, you know, for different reasons. But I mean, this is fantastic. You've really brainstormed some ideas to make it more cohesive again. And of course, I know one of the things that has changed tremendously over the years is just that inclusive, collaborative type of care that you've managed within the NICU. I will ask you, how are your staff holding up? You know, Mohan, how are they coping with all of this? Because they've had to pivot as well. It's just not just the stress on the families. There's a lot of stress on our staff right now. So how are they doing?
Yeah, it's been tough. It's been
Right,
tough. But as you know, NICU staff nurses are pretty strong,
right.
right? Right? Emotionally.
Yeah.
Certainly, a lot of our staff nurses had illnesses in the family,
Hmm.
with COVID, and sometimes when they're exposed to somebody at home with COVID, they have to be quarantined. So,
Right.
which means it's staff shortage in the NICU.
Mm.
So we had to get a lot of other nurses or float nurses, as we call them,
Yep.
to come and help us during these times. But our staff has been really, really resilient. Yes, it was really difficult,
Hmm.
but things started to flatten a little bit,
Hmm.
get better a little bit. We're in a much better space. But it was a whole new learning experience for us.
Yeah. Wow. Wow. It sounds like you are taking care of each other, which is the most important thing is coming together. You know, during a pandemic is definitely we need to work together to find a common ground. In the challenges that we're facing, whether it be at work or at home, and somehow get on the same page and keep
Right.
moving forward. Right.
Yes, yes.
Yeah, absolutely. Well, thank you so much, Mohan. I mean, I'm really happy that you're here. I'm delighted that you work in an area that is so fascinating, the microbiome. But I really am. We need to keep focused on the research, what we've been able to achieve with COVID-19 and in the NICU. So I'm really happy that you're going to be at our conference this year. So thank you so much for joining me here today.
Thank you, Fiona, and thanks for the opportunity. I appreciate it.
Yeah, absolutely. So thank you so much for listening in, everyone. Don't forget, you can join us for our Gold Neonatal Online Conference 2021. Registration is open right now. You can go to our website, goldneonatal.com, to sign up for all of the presentations that are going to be live. And we've also got some recordings available as well. So look forward to all of those. Thank you once again to Dr. Mohan Pammi for being with us here today. And of course, to all of you. Have a wonderful rest of your day, everyone. Bye-bye for now.
Thank you. Bye.